Again, so we just did this slide on psychopharmacology and the basics of how biomedical therapy works. Now I want to get into the three most kind of common types of drug therapy. The first is antipsychotic drugs. Now, antipsychotic drugs, we're looking at the psychosis of the mind. So for antipsychotic drugs, we're talking especially for things like schizophrenia and maybe even bipolar disorder to treat the manic episodes. They're usually antagonists. And when I say antagonists, remember antagonists block, right? And so we're looking at least in the case of schizophrenia, to block those dopamine receptor sites. But antipsychotic drugs have very powerful side effects. They work, but they have a lot of kind of baggage that goes along with them. So these really need to be prescribed under the careful care of, I would say, not only a doctor but probably a psychiatrist as well. These powerful side effects, one of the first things is tardive dyskinesia. Now, this is a fancy word, and I know at first when I talk about it, it probably seems like a big deal, but this is actually quite a big deal. Tardive dyskinesia is involuntary facial movements. So you can't like control your mouth or your kind of eyes blinking or certain facial features, certain facial muscles that you can't control. It usually happens when you're on the drug, but sometimes even after you stop the drug, it can continue on and there's like no reversing the effects. And people who then develop tardive dyskinesia feel very self-conscious about it. They feel like everybody's kind of looking at them because they're making these kind of like weird kind of rapid movements that they really can't control. And that is probably one of the first side effects of taking these drugs. These are fairly old drugs. I don't want to get into too much of the pharmacology of it, but they're getting better and better. I have a couple of ones there. You maybe have heard of Abilify or Seroquel. Risperdal is an old one, but these also have some side effects that some of the biggest side effects are things like what's sleepiness, and you're unable to really just have energy to do things. Weight gain is also a big one, diabetes. So there's quite a few things that go along with taking antipsychotic drugs that you also probably need to be under the care of a doctor as well. But again, they work. This is one of those things that in drug therapy, I don't think we say, well, let's just not do anything. For diseases of the brain, such as schizophrenia, something has to be done. Like talk therapy is not going to work. You just don't get rid of hallucinations by talking about them. So antipsychotics work. They're very powerful, and they do what they need to have be done, but they have some side effects as well. Always good and bad. Anti-anxiety drugs. Anti-anxiety drugs depress the central nervous system. Now think about that. If you're depressing the central nervous system, that means you're kind of calming the body down, right? Like think about our sympathetic and our parasympathetic system. We want to calm the body down. So it enhances GABA, which is an agonist. So we want to, these nerve endings, we want to like calm them down. And that's what, at least for GABA in the brain, the neurotransmitter, we're pretty sure that's how it works. Actually, we don't even exactly know how anti-anxiety drugs work, but once again, we do know that they work. Also, some serious side effects with anti-anxiety medications: headaches, nightmares, tiredness, again, is one of those things. But the biggest side effect is how highly addictive it is. This is a serious one because it is so highly addictive because it works so quickly. like at least Xanax. Xanax probably starts working in about a half hour to an hour. You can get, I mean, it's not like meth. It's not like methamphetamine, but it goes to work really, really quickly. That's why it becomes so highly addictive, because it works, and it works right away. Now, it doesn't last very long. The half-life of it doesn't actually last very long. So then you want to have that feeling again if you're going through another kind of anxious period. But you want to have that feeling, and so you take another one, and it works, and it works right away, but then it doesn't last, for much more than probably a half a day. So you can see it might become highly addictive. If you've ever heard of benzodiazepine, that's what an anti-anxiety medication is. Xanax is probably the most common one. You might have heard of Ativan. Valium is a really old one. What I really want you to know is that, especially young people, but anybody under 25 should be given anti-anxiety medication very sparsely, meaning this should never be a long-term solution to a problem. We need to sorry, I'm gonna close this right here. We need to give it to the patient when they need it, when they're going through a panic attack or something like that, but then it needs to stop, because it can cause some long-term effects, like just motor skills, like you're unable to really walk properly, to have some of those motor skills. It causes memory problems like dementia and memory loss if it's long-term. And so we need to be careful with that. However, when you stop taking the medication, then even more feelings of anxiety and insomnia, and other withdrawal symptoms then increase. So it's one of those really tough, well-working medications. It works, it's highly addictive, it's got lots of side effects, and if we aren't careful with it in the long term, it can do a lot of great damage. But for people who are going through, let's say, a panic attack or even generalized anxiety, like that's what you need right then and there, right? And so you don't really care what's going to happen in 20 years if you continue to take this. You want to address the problem right then and there. And then the last one I want to talk about are antidepressants. Antidepressants are agonists. An agonist opens, remember, like an SSRI or an SNRI. SSRI is selective serotonin reuptake inhibitor. SNRI is a selective norepinephrine reuptake inhibitor. And remember, think about the reuptake, right? Like it's going down the neuron, and then what doesn't fit into that keyhole just perfectly gets sent back up the neuron. Well, we want to keep it right there. We want to keep it in the synapse. And then as soon as the next key opens up, or as soon as the next kind of pocket opens up, it can do its job there. So antidepressants are very common, and they work really, really well. Again, for people with major depressive disorder, they work really well. But we're even now treating things like anxiety. We're not even sometimes treating with an anti-anxiety medication. We're treating with an antidepressant. Oftentimes, we even see them used in conjunction. PTSD, another type of phobia, anxiety, OCD. So these are a kind of across the board, an easy solution to a mental disorder. However, they're not nearly as addictive as, say, antipsychotics. So that's why sometimes doctors like to treat anxiety or things like that with an antidepressant rather than an anti-anxiety medication. There are fewer side effects today than we have with the earlier medications, but here's the important thing I want you to know. It might take weeks to cross. The BBB is the blood-brain barrier. Remember, I don't know if I talked to you, the blood-brain barrier is kind of like the way that your brain keeps out all of the bad stuff. Remember, like teratogens, how the placenta keeps out the bad stuff from the baby, from harming the baby that comes in through the mother's bloodstream? The blood-brain barrier is what kind of keeps bad stuff from getting into your brain to harm your brain. Well, the blood-brain barrier looks at an antidepressant as like, you can't have this, but you keep taking it, and after about 2 weeks, the blood-brain barrier is like, I guess this is okay. Yep, we can allow it to happen. So you're gonna maybe be prescribing an antidepressant to your client or your patient, and you got to tell them like, don't, like, you're not going to get immediate relief from this. Don't expect like tomorrow this to work. You take an antipsychotic or definitely an anti-anxiety medication, you will have results. You'll have results even before tomorrow. You're going to have results probably today. An antidepressant can take up to like 2 weeks. And so you have to be patient. You have to let it go to work. Now, there also are some side effects with antidepressants. Hypertension, which means, like high blood pressure. Weight gain, which is really, I mean, think about people who are going through depression and then they gain weight. In American society, that would just be like a double whammy, right? Dry mouth, where you just feel like dry mouth, that would be terrible. Constipation. There's also sexual side effects as well. So there's a lot of things that can happen with antidepressants too. But the thing is, you can be on an antidepressant for a much longer period of time. I've known somebody who's personally been on a antidepressant for like 20 years. They swear it works, and so they continue to take it, and they don't really have a lot of long-term side effects, at least none that I've ever seen or that they've ever been made aware of. Prozac is probably the most common one. You've probably heard of Prozac. Paxil, Celexa, Cymbalta, those are all new age. You might hear those on commercials, antidepressants. So I'm not even really going to go on from there. We'll talk about the rest when we come to class together on Friday. Talk to you later. Bye.